On behalf of the ResearchGate, it is so wonderful to welcome all of you to our conference this year. So we're still evolving through the COVID pandemic. And so the focus for our conference today and tomorrow is the strategies to handle emerging challenges in healthcare in the post and pandemic, if we are still even at post-pandemic. And then what's the next new normal and what challenges do we forecast and see based upon that for the nursing profession and the healthcare industry? It's wonderful to have so many great speakers with us. I will be moderating for today, and my great colleague, Dr. Robin Nelson, will be moderating for tomorrow, as well as will be presenting. I have the pleasure of starting off our conference, and what I'm particularly concerned with in the presentation this morning is how we prepare our students to be able to survive and thrive, indeed navigate, through the many challenges within healthcare organizations today. Across the globe, we have seen the implications and the results of the COVID-19 pandemic and how taxing it has been for all healthcare providers around the world, no matter what their discipline is: nursing, physicians, respiratory therapists. All members of the interdisciplinary healthcare team have been affected by the challenges brought forth by the COVID-19 pandemic. What we're going to focus on for the next about 40 minutes or so is what are complex systems. Healthcare is a complex adaptive system, and I'll talk briefly about what that means. But we have to be cognizant of the fact that we are training our students, whether medical students, nursing students, any healthcare professional student, how to be able to provide safe care, to be able to provide informed care and patient-centered care. What I don't think we are as adept at is preparing our students to be able to enter into a very chaotic, very complex environment, which is healthcare. So this morning, I'm going to be speaking about complex systems and helping our students survive and thrive in healthcare. Learning outcomes for this presentation include understanding the components of complex adaptive systems. And now this is a topic that we could have at least an hour or two just talking about what are complex adaptive systems and what are the implications of those systems. I'm going to give a really brief overview and align that with how it affects our students once they graduate from our healthcare programs. I would like for us to look at transition theories, and we will talk about two. Analyze the gaps in current strategies used for transition into practice. There are steps that we're taking to try and prepare our students. I think that we have opportunity to build upon those strategies that we have in place. And then I want to talk a little bit about resilience. There's been a lot that has been presented at various conferences about resilience, especially healthcare professional resilience. We are very well versed in how the COVID pandemic has affected the resilience and has caused burnout among our healthcare professionals. And then finally, integrate holistic practices to promote resiliency in new graduates. We certainly do live in a world that's becoming increasingly complex. If we look back in 2019, what we faced in healthcare organizations completely upended in 2020, and we are still seeing the effects of that pandemic on our healthcare organizations and our healthcare systems. And so the idea that using the style of thinking that we had in 2019 within healthcare organizations is not really effective in what we've had to face in 2020, what we've had to face this year, and there still remains a degree of uncertainty about what the healthcare environment will look like in 2022. So we have to make sure that the systems that we have in place and the ways that we're thinking about healthcare and the delivery of healthcare need to be able to match the complexity within the healthcare systems that we're facing today. So an overview of the presentation, we're going to start off with complex adaptive systems, move to two transition theories, Schlossberg's transition theory, and then we're also going to talk a little bit about managing transitions, and then finish up with transition shock and tie that into how we can prepare our students to become more resilient. So taking a closer look at complex adaptive systems, we all understand complexity, and what we see as complexity in the United States might be very different than what complexity looks like in the UAE or in the Philippines or in Singapore or in Lebanon. And so as we walk through this presentation, I encourage you to really think about how what we're discussing really pertains and applies to your particular healthcare setting. Complexity, there is a huge amount of complexity in all organizations and in all types of systems, most notably in the healthcare system. The focus is generally on relationships between the components within organizations rather than the individual parts. So for instance, we can't just focus on physicians, we can't just focus on nursing and expect the healthcare system to function effectively and in alignment. So when we talk about complexity, we have to look at all of the integrated elements and various parts of the system. And then there is a difference versus complex with complexity versus what's complicated. So not all problems are the same. Obviously, a simple problem is straightforward. It's usually solved by maybe following instructions, changing a protocol, instituting a new policy. When we move into problems that are more complicated, we find that there are a large portion of them have very definitive components and parts that we have to sort through and resolve things on a lower level before we can reach the overall goal. Usually experts solve these types of problems, and the outcomes are predicted with a certainty. So really with complicated problems, a little bit more involved, but there's some level of certainty that the process we're using is going to help us reach our outcomes. When we reach the level of complicated problems, or complex problems rather, these problems are unique. So again, COVID-19 pandemic, a very unique problem that taxed our healthcare systems beyond anything that we could have planned for or thought of. There is a high degree of uncertainty involved with complex problems, and usually the outcomes are not predictable because the elements within complex problems can be changing at any given point in time. With complex adaptive systems, they are definitely multifaceted, interactive, and open systems, and they respond to changes in the external environment. They're complex in that the interactions and relationships between the components are the focus. They're adaptive only to the degree that they're able to change. So when we think about our individual organizations, we have to consider how adaptive or how resilient or how flexible are we to the changes that we have to make due to external circumstances. Within the COVID-19 pandemic, we saw that a lot of healthcare systems and organizations had significant difficulty in dealing with the level of change and being as flexible as they needed to be. And then from a systems perspective, systems consist of many interdependent and interactive components. And so what happens in one component very much can affect the other components as well. We focus on the interactions among the components, which influence the overall functioning of the system. And so new behaviors, new ideas, and structures generally emerge from relationships within the system itself. If the system is highly functioning, then you have an organization that we sometimes term as learning organizations, but these are organizations that are able to assess, implement, and change in a relatively effective period of time. They are generally self-organizing, and so the components they adjust mutually to changes within the system, but they can be unpredictable and can be bordering on chaos. There are many times that I have been teaching students and I have used the term chaos to describe the environment within healthcare organizations. They are generally nonlinear. And so when there's a small change in one component, it does have an effect in the other components within the system. And small changes can have a tremendously large effect on the system. In generally, complex adaptive systems can be resilient and robust, but it is most definitely tied to how strong the relationships are within the components and within the healthcare system. So healthcare systems, or healthcare as a complex adaptive system, has three levels. On the macro level, we generally, and I'll use the United States as an example, many systems have a parent or an owner system, and some of those in the United States are the Tenet healthcare system, Healthcare Corporation of America, and Kaiser. And in other countries, sometimes the healthcare systems are owned by government agencies. On the middle level are the hospitals within those larger systems. So HCA, for example, owns various healthcare systems within the United States, and the hospitals that are in part of that system form that middle level. On the micro level, now is where we find our healthcare professionals and hospital units and individuals within the hospitals. Healthcare professionals are subject to change related to the quality of relationships among all levels within the organization. So we find that nurses sometimes really do not understand all of the implications of decisions that are made on the macro level and even on that meso or middle level. When we talk about new graduates, and here my focus is new graduate nurses, but indeed this is for any new graduate in our healthcare professional programs. Some challenges experienced by new graduates include lack of experienced mentors, preceptors, and coaches. I have been in contact with students who graduated 2 years ago from a program that I was teaching in. And when they got out of school, they were texting me saying, Dr. Hedges, the preceptor that I have has only been here 6 months and he just graduated, 3/4 of a year ago. I don't feel comfortable. I don't feel safe. I don't feel like this person has enough experience to help me learn what I need to learn. Lack of professional confidence. We find the trajectory within nursing programs, at least this has been my experience, that by the time students get to their senior level, they really just want to graduate and pass their licensure exam because they feel confident on what they have learned up until that point. What we find when they enter into the workforce is that now the clock starts over and they find themselves in situations where they don't have that professional confidence. They don't feel like they feel their instructors are no longer there. That safety net that perhaps maybe some of them took for granted is no longer there. So lack of professional confidence is a major issue for new graduates. Inconsistent orientation. And here hospital systems in the United States, have tried to mitigate this by developing internships, which is essentially designed to be a protected period of time where a new graduate is able to work with another seasoned, experienced nurse in order to orient to what their role is on that particular unit. Where I say inconsistent orientation is, again, report from new graduates is that they are supposed to be on orientation for let's say a 4-week period of time. And into 2.5 weeks, staffing on the unit is such that they take that student or that new graduate off of orientation and give them a full patient assignment because they don't have enough nurses to be able to provide care safely for all of the patients. At some point in time, the new graduate will go back on orientation, but it's an interruption of what new graduates feel that is that safety period of time for them to learn and assimilate into their new role. Bullying and incivility are significant problems within nursing and within nursing education and within healthcare across the United States and internationally. And so a lot can be said about this. Dr. Cynthia Clark has done extensive research and work in the area of incivility, and we are so fortunate to have her speaking this morning. But suffice it to say, regardless of the amount of research and attention that we have placed on incivility, we still have significant problem, and new graduates are still leaving in significant numbers because of incivility within the healthcare setting. And then finally, rapid change, complexity of the patient care and the patient status, comorbidities of patients. The patients in hospitals nowadays are extremely sick. Used to be, when I first got out of school, it was pretty straightforward. Somebody came in with pneumonia, we treated them for pneumonia, and we sent them home. Now we find that the patients who are in patients in hospitals have several comorbidities and chronic as well as acute illnesses. Students are trained in a protected setting to be able to be knowledgeable from a pathological standpoint and from a treatment standpoint, but it really is an extremely different environment once they reach the healthcare setting post-graduation. So let's talk about how do we prepare students to transition into complex adaptive systems. We know that a transition process takes place over time. Change occurs over time. Students have to be able to leave the educational setting, moving into the practice setting. And we know that that transition can take up to 5 years for a new graduate to reach what we term a proficient stage within their healthcare practice. We know that there are phases of assimilation and appraisal. So when I'm a new graduate and I become a new RN in a new environment, I first have to learn what is the culture of that organization. And then beyond that, what is the culture of that unit? What are the types of people that I am working with? What is their perspective on the culture of the unit? What is the diversity of that nursing workforce within the unit that I work and within the larger hospital that I'm employed in? So there's a lot of internal reflection. How do I fit in? How do I show that I know what I'm doing? How do I learn comfortably? How do I feel comfortable with my role as a new graduate and a new RN? And then I look for external evidence. What is the support around me from my colleagues on the unit? What is the support from the hospital in general? What support do I have from my physician colleagues? So internal reflection, and then we look for verification or validation on an external basis. In looking at Schlossberg's theory of transition, there are 4 considerations that we need to make. And so there is a precipitating event, and what we will call our precipitating event is graduation, successful completion of the program, and completion and passing of the licensure exam, and now entry into practice. When we look at that transition, coping resources are very significant. On an individual basis, I, as a new graduate, what coping strategies do I bring? What is my life been, my life experiences have been from my family of origin through my nursing program, my other life experiences, and all of that added together? How much does that enable me and strengthen me to be able to cope with varying situations that are highly significant to me as a new nurse graduate? Looking at the environment. If a new nurse is in a large healthcare setting, most of my students are entering into intensive care unit situations, into neonatal intensive care unit, into the ER. So what is the nature of that environment, both on the larger organization as well as on the unit level? And then we have to take a larger step back and look at the implications from the pandemic and look at what is the healthcare environment in general and what challenges has that presented that have filtered down to the nurse, to the physician, to the healthcare professional on the unit. Looking at individual characteristics as well. What characteristics do I bring? Am I resilient? Am I internally motivated? Am I externally motivated? How do I handle conflict? How do I handle change? Do I feel comfortable with change? How do I feel about asking for help and asking for questions? How do I feel about my level of self-confidence? And then when we look at transition, Given all of those circumstances and all of those resources and all of that support, are we able to adapt to change? Are we able to resolve inconsistencies that we see within our environment and even within ourselves? The situation or the precipitating event really brings out what is our sense of control in that situation? What is my role? What is my change in the role that I am facing? I was a student, now I'm a professional nurse. And then what is the stress that I'm carrying with me into that new situation? Again, characteristics and psychological resources come into play. Also looking at support. This is where incivility within healthcare organizations is so detrimental, especially to new graduates and even new staff joining a hospital for the first time. What is the relationship and support within that unit and within that hospital for that new person? Then also, what are my family relationships like? What support do I have in my personal life and within my community? All of those things factor into resiliency and my ability to call upon those resources for support. And then what strategies can I come up with to modify the situation that I'm facing? How do I view that? How do I look at it? How do I analyze it? What is the meaning in that situation for me? And based upon all of that, how do I manage my own emotional response to that, my own psychological response to that? And then how do I manage my stress given what I'm facing? When we look at managing transitions, and I'll go through this very quickly, William Bridges in 2017 devised the process of transition. And generally there are 4 phases. In the beginning, there's an ending phase. And what's important to understand is that ending phases can be good. I've graduated, I've been successful, but they still have inherent stress and change that's required from that person. People go into an ending phase and then move into a neutral zone. Where am I? What is it that I am faced with? What kinds of things do I need to be paying attention to? And then that leads to self-reflection and some reorientation. Okay, I successfully completed nursing school. Now I'm a registered nurse. What does that mean? What is expected of me? What do I bring to my new role? And then culminating all of that, individuals start with a new beginning. So with the ending phase, regardless of the nature of leaving, there is going to be stress, whether it's good stress, graduated, or bad stress. It was a situation that I did not want to have to leave. The neutral zone, the new role is not yet formed. And so again, reflection and reorientation. With the new beginning comes assimilation into the new role, and then along with that, self-confidence in adapting to the new environment. Looking at transition shock, what we find with new graduates is there are inconsistencies between what they found in nursing school and what they're experiencing in the workplace. We have addressed this for decades. We have done our best at revamping nursing education in order to bridge that gap and to enable our students to make that transition effectively. We still have ongoing work to do, especially as healthcare organizations become more complex and change becomes more rapid. Students become aware of inconsistencies when they transition into the workplace. Gee whiz, we were taught this way in school, but here we're doing it this way in the healthcare setting. And then even adequately prepared nurses, our A students, our students who flew through the program and did very well in clinical orientation and in clinical rotations, some of those new nurses will feel unprepared and intimidated. A couple of factors that I've highlighted here in this model for transition shock, and you will see in the middle there's loss and then doubt, confusion, some disorientation. In responsibilities, our new graduates face changing roles and tasks. In looking at knowledge, there are roles and responsibilities that they have to become knowledgeable about. Performance expectations. What do I expect of myself? What do my colleagues expect of me? in looking at roles, role stress and strain. And then finally, in relationships, leadership and collaboration skills, professional culture, and peer support are all very significantly tied to the success of new graduates when transitioning into practice. New graduates fear being exposed as clinically incompetent. They feel they are failing to provide safe care or hurting a patient, not being able to cope with their new role, being rejected as a valued and contributing team member. I've had new nurses say that their colleagues don't take them seriously. They don't answer their questions. And then finally, many of you probably are familiar with the imposter syndrome. And very briefly, this is the idea of I'm going to be found out as really not knowing what I'm doing, really not being competent like I think I am. All of these are very significant fears for new graduates. So how do we prepare our students? We do from a skills standpoint. We have programs that are designed for transition into practice. We have elements within our nursing programs that are immersive experiences on the unit, 12-hour shifts in the real-time setting, preceptorships once students graduate and are partnered with a seasoned nurse, and then mentorships as well. Within nursing education, we teach students to think critically, we teach them to use clinical judgment, and we teach them to be competent. And the ways we do that are through moderating their thinking and then promoting what they're doing as tasks and skills. And so this continuum just shows you we have didactic knowledge, we have clinical skills, we teach them a process for which to develop patient care and take care of patients in a way that leads to good health outcomes. We hope that they pass the licensure exam, and based upon all of that, we judge that these students are adequately prepared to take care of patients. But how can we teach our students about the complexities of healthcare organizations? Here's what I find has been my experience within both, mainly in bachelor's degree programs. In associate degree programs in the United States, my experience has been we don't really include a lot of knowledge and content about healthcare organizations in general. But of the things I see that are covered, types of healthcare organizations, tertiary care, primary care, what is the structure of that organization? Is it multi-hospital system? Is it one hospital? Is it for-profit, not-for-profit? What type of nursing care delivery systems are there? Primary care, team leading, whatever that healthcare organization, how they structure the nursing care and the nursing staff. We do talk some about reimbursement and other external factors, what's happening on the health policy level. These are very important elements to include. Where I think we need some work is looking at helping our students understand organizational dynamics. And what do I mean by that? Resource allocations, models for decision making. How do healthcare CEOs and leaders make decisions that affect nurses on the unit level that they don't necessarily understand that process? Looking at organizational behavior, cultures, and values. Sometimes we have folks who come from the hospital system to talk about, we want you to come and work in our healthcare organization. Here's what we do. Here's what we're proud of, our mission and values. Nobody really talks about the stress and strain that nurses, physicians, healthcare providers experience in healthcare organizations across the board. What is internal bureaucracy? Nurses have a really hard time on the unit understanding what in the world the people on the leadership level are doing. Do they know what we're faced with? How are they making these decisions, and how can we be more involved? And then looking at the effects of conflict, stress, and patient complexity. I think in these elements, I don't believe we need to go into really significant detail about resource allocation, how reimbursement affects those things. But I do think we have opportunity to be able to talk about some of the realities within healthcare organization. And then finally, diversity in the nursing workforce and within the healthcare environment. We have the privilege of dealing with colleagues who come to us from all over the world. How do we interact? How do we learn about their culture? How do we interact effectively in order to bring out excellent patient outcomes? And then change is always in the background. Images do speak louder than words, and these images do not just come from the COVID-19 pandemic. Nurses are tired, physicians are tired. Nurses experience loss. In the emergency room, in this lower left-hand corner picture, I envision this nurse to be working in an emergency room or an ICU, and perhaps maybe there has been a death and there's been a quick turnover because there are other patients that are coming in. Healthcare professionals really don't have time to grieve and time to process before they need to take care of the next patient coming in. And so when we talk about resilience, it's the ability to bounce back from negative situations, the ability to use coping mechanisms, perseverance through challenges, being able to adapt, being able to recover and adjust from change. And then now we're finding within the literature, there's more and more content about resiliency. And we have, and this is a very strange way to say this, we have the COVID-19 pandemic to thank for that, because prior to 2019 and 2020, the content in the literature was not as robust as it is today. Students must be resilient. So despite our research and our zero tolerance policies, we still have new graduates being exposed to incivility, lack of workplace support, experiencing burnout, and having difficulty with self-confidence and coping skills. There's a difference between balance and integration. There's really never going to be a balance between work and personal life. It is an ongoing integration in managing both of those spheres within our lives. So where does resilience fit in our curriculum? It begins with student orientation from day one, talking about to our students, the program that they've entered is challenging, the profession they're entering is challenging, and healthcare systems are chaotic, they're dynamic, they're complex, and we need to be able to prepare them for those challenges. Needs to be a concerted effort rather than just a lecture or two. We need to discuss ramifications for students with existing anxiety and ineffective coping skills. We can identify students who are at risk and come to us, and some of them will express what their challenges are in their personal lives. For those students, we need to be able to look at how best do we support them and prepare them for the challenges ahead. There are various self-assessments and other tools that are available on the internet, some with a fee, some that have no expense, that students and faculty can take to judge and assess where our own resilience fits in and how capable we are to role model resilience and therefore help our students become more resilient. So what exists and what is needed? We have increased evidence in the literature about resilience due to COVID-19. More is needed. Students must receive resilience education and training prior to transition into practice. We begin to focus on passing the licensure exam and making sure that all of the regulatory requirements are in place. We need to be able to have, I believe, one final seminar or some effort or strategy to talk one more time about what healthcare organizations are like and what challenges they're going to face. And faculty must always look at our own personal resiliency. We cannot pour from an empty cup. And if we are not resilient and taking care of ourselves, we cannot role model that for our students. So the reality is not about removing all the stress from our lives. Any form of uninterrupted stress will become excessive stress and eventually lead to burnout. We need to focus on promoting individual strategies to help reduce the inherent stress that we know is present in healthcare. Some strategies that have been covered in other conferences and will be covered throughout the 2 days we have here: mindfulness, stress management, paying attention to our personal health, and then utilizing strategies for healthcare professionals after they enter into practice. Some activities that can be implemented within healthcare professional educational programs are these, and they can also have application into healthcare settings. Internet resources are available to help assist us with developing resilience strategies. And these are two, the National Academy of Medicine and then Healthy Academics. So from an educational standpoint, this organization has resources to help assist us to promote resilience in our students. So some closing thoughts. Healthcare organizations are complex adaptive systems that require skills beyond nursing. There will always be inconsistencies between academia and the real world. It is an ongoing effort for us to be able to try and bridge that gap and to be able to promote our students' transition into practice. Students to varying degrees will always experience transition shock. We can help mitigate that with strategies that we use throughout the nursing program, not just at the end. New graduates are an integral part of mitigating the nursing shortage, and so therefore it is within our professional best interest to do everything we can to support our students. More work needs to be done to prepare our students to navigate the complexities of healthcare systems. Nursing skills, nursing competencies, we have to mirror and marry that with how do we help them navigate through the challenges of healthcare systems. And promoting resilience is a key component to new graduate success. Thank you very much for your attention and your participation at this conference. I appreciate and am grateful for the opportunity to be with you today. Thank you.